Morning everyone, summer's finally here. It's so nice to get into the garden finally and soak in a little bit of vitamin D. So video 5, so we said we're going to chat about frequency of treatment in this session. So one of the things I find, if someone's not getting a response from the treatment, one of the reasons can be kind of dose and making sure we're dosing. Another reason is making sure that we're treating the relevant area to the disease, or equally, if we've got any compensation in other areas that maybe we need to treat as well. The third reason is very much around frequency of treatment. And what I see time and time again is not treating frequently enough. So with laser, it's an accumulative effect. So the more we treat, the faster, the better the response that we're going to get. Now, obviously, it depends on what kind of condition we're treating. So, if we're doing this for sort of sports maintenance, then the frequency of treatment is going to be very different, because actually the goals and the aim of the treatment is different. So taking sports side to the side, if we're talking about obviously medical conditions and the kind of rehab side of things, so I split it into two. We've got our acute conditions and we've got our chronic conditions. Now, again, it depends on the laser you're using, the recommendations by that company that manufactures that laser. These can slightly vary, and again, from book to book, it's going to vary again from there. But I generally follow two protocols. So if I have an acute condition, my goal is that I want this patient to be, completely better. So we want this condition to be resolved. So my aim is to start with a couple of treatments and obviously monitor the response there. But for many of the kind of acute conditions, we're looking around 5 to 6 treatments in the first couple of weeks. But again, the aim here is that by the end of that couple of weeks, the treatment is completely resolved. Now, obviously, we do also have our post-operative cases as well. And if we're literally just treating because, let's say it's dog castrate, bitch spay, we're not anticipating anything to be wrong with these cases. We're just wanting to just help with the healing and obviously give that extra bit of pain management. Then a couple of treatments, one on the day of surgery, if all is okay to do so, and then one at your post-op check in a couple of days. So our acute conditions, post-ops, everything's fine and dandy. Couple of treatments. Same with our dentals. Couple of treatments is all we're probably going to need. If we're dealing with more of an acute condition that's a little bit more involved, or that dental that's had maybe a little bit more work done within the mouth, maybe a post-op that's a bit more invasive, such as orthopedic surgery, then we're probably going to follow that sort of more intensive treatment. So the aim would be 3 treatments in the first week, 2 in the second, and then reevaluate how they're doing. But the aim would be that by that sort of 5th, 6th treatment, we're pretty much good to go. So that's our acute side. Now, again, like I say, this does vary device to device, but the main thing is that we're giving quite a large dose or kind of intensive treatment in a short period of time to get this cumulative effect. We don't want to leave it too long between sessions. We want to kind of build on what we've got and keep building. So that's acute. Our chronic side, now with our chronic conditions, we're obviously most of the time the aim is to get them onto a maintenance. So we're not going to be completely getting rid of the root cause here. The aim is that we're going to kind of get them comfortable, help the condition, and then manage it long term. So we're not going to be stopping treatment here. So we're going to follow 3 stages. We're going to have the induction phase, which is a bit more intense, then our transition phase, and then on to our maintenance. So with our induction phase, we're following that same kind of protocol as the acute treatments, sort of 5 to 6 treatments within the first couple of weeks. And again, it's this accumulative effect. We want to kind of really give them that good blast and kind of really get everything under control as quickly as we can. So 3 treatments the first week, 2 in the second, or 2 to 3, and see what the response is. Now, key thing here is if our response is going well, great, let's start transitioning. If we're not quite where we want to be, then maintain that intensive treatment until we do get the response that we're wanting. Don't be afraid of kind of, you know, maintaining that intensive frequency. One of the big issues is that people again drop down too quickly. So we're looking for that patient response by the end of that second week. Now if we're happy with that response, like I say, we're going to then start transitioning them down. Now this is very personal to every patient as we transition down to maintenance. So you're going to do, you know, once we've done that twice a week, we're going to go down to once a week, every fortnight, every third week, every fourth week. And we're going to transition them down to where we're still seeing a good response, but we're not starting to see, you know, some of the symptoms start to creep back in. So maybe they start slowing down again, or maybe stopping on a walk if we're dealing with an OA case. So we're just transitioning down, that we've got as long as possible between treatments, but we're not going backwards in any shape or form. We want to be still progressing. And what obviously the aim is that the effect of the treatment lasts longer and longer, kind of each time we're treating. And then we get them onto the maintenance. So maintenance is completely different for every patient. So we talk a lot about OA management and obviously maintenance treatments here. So with these guys, you know, you can have some patients that go every 6 weeks, every 4 weeks, you know, every 3 weeks, every 2 weeks. It's whatever works for that patient, where they're having, you know, the longest possible gap between treatments, but they're still seeing benefit and they're still doing well. Quite often we see, you know, younger patients that are maybe early stage disease go that little bit longer, versus our older patients kind of end stage disease process is maybe not quite cope quite so long between treatments. So it's completely variable, patient to patient. And the other key thing is that we should never be afraid of increasing and decreasing treatments as we go along. You know, as soon as kind of the colder months start hitting our patients, you know, we naturally see a decline. So let's increase our treatments. When it hits the summer months, we naturally see them doing better. So let's decrease frequency. If they overdo it because maybe they went on holiday, had an extra long run on the beach and they've overdone it, let's increase treatments and get them back to being comfortable and decrease again. So it's a completely flexible treatment, and that's one of the reasons I love it, is because we're not limited to a certain point, you know, how frequently we can treat them. But my bugbear with frequency is it's one of the things that we maybe don't do enough of. I see time and time again, whether it's owners, they can't get in frequently enough, or whether it's, you know, using it as part of another session, so it's not the standalone treatment, so you're just doing a one-off. It's really important that if we want the results from our lasers, we need to be treating frequently enough to get that. So like I say, when someone says to me that, you know, they're not getting the response from the treatment, the three things I check is dose, location of treatment, and frequency of treatment. Are we treating frequently? And if we start increasing that frequency, what happens to our patient? My own dog recently had dental. He had quite a few teeth out and had some quite horrible holes there. And you know, even throughout that time period with treating, I had to increase and decrease frequency depending on what response I was seeing in the patient. So don't be afraid to increase frequency. Don't be afraid to maintain frequency. You know, if you're not quite where you want to be, don't drop down too quickly. And you know, if maybe you've had some patients that you like, maybe you haven't seen the response, why don't you try treating more frequently, longer, and see what happens with those. So that's all about frequency, or frequency of treatments. I hope that again was helpful. Again, any feedback is always gratefully appreciated with these videos. Haven't quite decided what I'm gonna cover in the next one, so it might be a little bit of a surprise. But equally, if there's anything you want me to cover, then feel free to reach out. But I hope you all enjoy the little bit of sun that we're getting, and we'll see you in the next video.